Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today, we have a special sponsored episode. Jared Pelo is an emergency medicine physician and innovator. Dr. Pelo helps lead the Ambient Clinical Intelligence team at Nuance, where he is Chief Medical Information Officer. He's here to talk about the Dragon Ambient experience at Nuance. The exam of the future has arrived with clinical documentation that writes itself. Jared, welcome to the show.
Thanks so much, Kevin. I'm excited to be here. Big fan. Been reading the blog forever, so excited to talk with you.
Well, thank you so much for your readership and support. And first off, I'm just interested in hearing your story and journey to where you are today.
Yeah, so, for me, it really started 2012. I've been practicing for a few years after residency. I did my residency at the University of Virginia, practicing in Lynchburg, Virginia, and busy emergency department, 100,000 patients a year. And I grabbed my partner during a break and I say, "Hey, Andy, you seem like the happiest guy in our group. How do you stay so happy?" And he said, "Listen, Jared, every day I have off, I dread coming back to work." And to me, is a little bit of a punch in the gut, worst pep talk I'd ever heard. And he followed it up, though, with a couple nuggets. And he said, really the people that seem the happiest are those that either go into administration or those who innovate and try to make healthcare better. And so I tried exactly what he told me to do. I became a medical director for a year, and I'm not the hospital administrator or medical director type. That's hard. I tip my hat to everybody who does that day to day. That's hard work. But during that period, I was driving about an hour to go to a satellite hospital where I was a medical director. And we had a Scribe program and at the mothership, but not at that place an hour away. And around the same time, Google Glass was just becoming generally available for innovators. And so I saw that and I thought, why can't I just wear Google Glass? My scribes back in Lynchburg can follow along. And I started grabbing one of my scribes from Lynchburg and taking him with me on these drives to this smaller hospital. And we started talking about this. And we started talking about, well, really in the future, if we just capture all this data, someday computers will be able to do this for us. So in 2014, we started a virtual scribe company. And in 2017, we were acquired by Nuance, became part of Nuance because their vision was completely aligned with ours. And then it's been over a year now, the Dragon Ambient experience became available, where you do record your visits and then AI writes your note for you. And so that's kind of how I ended up where I'm at.
I talk to a lot of physicians who are interested in getting involved in that innovation space. So if you were to advise these physicians, what would be your number one actionable tip?
It would be to get involved. I mean, when you look at healthcare and all the problems in healthcare and you talk to other providers, we have a lot of the answers. Like, we know what we want. And, when I first started the first company, I had 3 other physicians that came on board as co-founders, but they were too scared to cut back their shifts, to really commit and do the work that needed to happen. And you really have to make a sacrifice and say, I'm committed to actually trying my hand at this. There's no guarantee that you're going to be successful when you try to innovate in healthcare. But if you want to make a difference, you really got to dig in. And you can do it on the healthcare system side. I think that's safer than starting a startup. I would not say that's like a sure bet at all. But that's kind of how I decided to do it. I really just think it's just making that decision. I want to do this and jumping in and trying it.
Now, did you have a business background prior to your career in medicine?
No business background. Actually, I went to a startup accelerator. That's why I was in Lynchburg, Virginia, and I ended up in Durham, North Carolina, because Lynchburg, Virginia, not the tech mecca of the East, but the Triangle, the Research Triangle Park and the Triangle down here in Raleigh, Durham, there's a lot of great tech. And so came down here, joined an accelerator that helps me kind of get things off the ground, found my co-founders, all of those types of things. And so, yeah, if you're going to start a startup, I would definitely say find the right mentors, find the right people to help you get off the ground.
Now, during the COVID pandemic, it's really accelerated the involvement of artificial intelligence in healthcare. Now, in your opinion, how has AI evolved over the last decade?
It's almost a question of how it's evolved over the last few years. I mean, AI, 10 years ago, and let's just take Siri, for example, when we
Mhm.
first started dealing with Siri. And she was kind of fun and she had some rules-based jokes she might tell you, but you wouldn't really call her intelligent as a virtual assistant. And I remember when we first became part of Nuance and talking to researchers about what we wanted them to build with our data. And they would say, oh, so you want the Harry Potter experience. You want the quill
Mhm.
floating in the air next to you, writing a summary for you. I was like, yeah, that's exactly what I want. And when we said that, they're like, you're crazy. That's like impossible. Or they said it's probably 7 or 8 years away.
Mhm.
And now, 3 years later, we're already at the point where we're writing a majority of the clinical documentation just with AI. So I just think sometimes we forget about exponential growth of technology and how much smarter things get and how much faster. And I really think we're at that tipping point
Mhm.
where we're going to see things go from concepts for so long to becoming the real thing. I mean, think about streaming video back in 2000. Everybody thought it was a great idea, but there wasn't bandwidth, there wasn't technology, it wasn't going to work. Now, almost none of us have, cable anymore. We all stream our video. And so I think we're just getting to that tipping point where we're going to see AI go from concepts and used minimally to being used widely and really driving a lot of what we do, not just in healthcare but everywhere.
Now, I'm looking forward to seeing how AI can improve the lives of physicians. And during the pandemic, one of the themes on my blog and the podcast, of course, is physician burnout. Surveys report almost half of physicians indicate that they are burned out. And of course, that number has only grown during the pandemic. Where should leaders look to leverage automation and, more specifically, conversational AI tools to limit this administrative burden on clinicians?
Yeah, I mean, when you look at physician burnout, there's lots of different reasons around it. Of course, administration is a big one. Loss of autonomy is another one. ZDogg MD talks about the kind of the moral wound. And I think it's all about how do you fix the problems that will make it so you can connect with the people you're caring for? And what technologies, if you're going to use AI to fix that, how do you implement an AI program that actually helps providers and patients connect? And I think that at the heart of it, physicians, healthcare providers across the board, we chose this profession because we felt called to it in one way or another. Like either we loved the science or we love to help people, we love to connect with people. And then we got into it. And the reason we feel burned out is because it's not fulfilling that need that we
Mhm.
entered healthcare for. And so if we can use technologies like DAX to go ahead and offload a bunch of my clerical work so I can actually look at my patient in the eyes when they're telling me stuff, I can look for nonverbal cues because I'm not so busy staring at the computer typing. I can actually be a much better healthcare giver. I think that's huge. And I mean, we know that burnout, if you're experiencing burnout, you're twice as likely to have a medical error in the next 3 months.
Mhm.
So there's so many good reasons to try to fix the burnout problem.
Let's go ahead and talk about the Dragon Ambient Experience, or DAX. Now, how can ambient technology help bring back the human element of patient care to improve the patient-provider relationship?
Yeah, so the way DAX works is really just taking that conversation that you would have with your patient and do all the documentation and clerical work for you. So I like to say it's the provider patient relationship of the 1970s with the technology of the 2020s. We want discrete data. We want better data to take care of our patients.
Mhm.
Absolutely. But we also want to connect with our patients and have a great relationship with our patients. And so I think that DAX, the way we really tackle this problem is let's solve the number one pain point for physicians, which is being stuck looking at a computer instead of my patient. And then start planning towards all those other things you're going to be able to do with structured data and automated data capture and all of the downstream things you can think of where AI can be implemented.
So I'm an internal medicine primary care physician, and I was wondering if we could talk in detail about a typical workflow. So if I were to use DAX and I walk into the exam room, walk me through the step-by-step process of how this product would work.
Yeah, so what you do is you pull out your iPhone, you see a schedule of your patients that day, you pick that patient. If you do pre-charting or chart review before you enter the room, you could say a few things, patients following up, hemoglobin A1C came back high, so the office called and asked her to come in. Go ahead and enter the room, have a normal conversation, and all we're going to ask is to be explicit around certain things. So physical exam, while you're doing the physical exam, just call out your findings. If you train DAX that you have templates, DAX is going to go ahead and pull those templates in, and you can just call out the abnormals, rails at the bases, bilateral lung fields, trace pedal edema, bilateral lower extremities, whatever you're finding on your physical exam, call those things out, and DAX is going to switch out the normals for abnormals. When you get to your assessment and plan, just go through it and explain it to the patient. For your diabetes, we're going to increase your Lantus to 15 units. For your hypertension, going to keep you on the lisinopril. For your depression, going to increase your Zoloft. If you go ahead and explain things like that, when you leave the room, DAX is done. If there's anything you didn't want to say in front of the patient, patients showing malingering behaviors or whatever you might not want to say in front of the patient. In this day and age with open notes, it doesn't really matter. Mm-hmm. But if there's anything that you didn't want to say in front of the patient, you can say it right when you leave the room. As soon as you hit stop, that complete recording is put through the AI, and we parse out the speakers, so we get clean transcripts of everybody who's speaking. And then it's put through our natural language generation model, and it writes the note for you. And it separates it into sections, pulls out discrete data points, can kind of do all of the things that you would normally do. We still don't think it's quite ready to go direct to a physician yet, so we do put it through a quality review. So we have somebody trained up in internal medicine. They listen to the whole recording, read over that note, make any corrections or edits that you might need, and then they put it in the EHR for you. Within a couple hours, our contracted time is 4 hours, but usually within a couple hours, that note's back in your EHR. It's near 100%. You read it and sign off on it. So what we found is we save most doctors about 6 minutes per patient. So if you see 20 patients in a day, we just saved you 2 hours of documentation time.
So if I'm having a conversation with a patient for the history of present illness, for instance, DAX would transcribe that, and how would that look like in the final note?
That's a great question, and I think that the best way to really talk about it is to show you. So we have these primary care models where we've trained from physicians meeting with their patients, we've trained DAX. So what I want to show you is I'm going to share my screen with you. I've pulled it into a Word document, so it's not in our interface. I can't show you that, but I'm going to just show you a note that was written, complete AI. No human has touched this yet other than me copying and pasting it over to Word. I'm not going to talk a whole lot. I'm going to kind of let you read through it. But this was, I told somebody, you just went to the ER, you have these medical problems, and we had just a totally normal conversation. And this is the output, you can see where it's calling out some past medical history in the HPI, talks about going to the emergency department because he had chest pain while doing yard work. They said not a heart attack, no blood clots in their lungs. And if you were to listen to the conversation, this is completely normal. In the conversation, he said, well, my wife made me go. And that doesn't necessarily make it in the note because that's not necessarily medically relevant. Although it does bring in the patient's grandfather, because I asked about family history, he had heart disease. It went ahead and pulled in a review of systems from the conversation. I told it to use my normal physical exam template, which is a big, complete physical exam template. So it pulled in kind of this whole physical exam. And then down at the bottom, it went ahead and wrote my assessment and plan for me. We're getting to a point where I'm getting very excited, because the point I want us to get to, right, is right now we have a quality reviewer and it takes a couple hours, and that's great. But it gets me excited about the point where I get that note within seconds, or I'm talking to my patient and there's intelligence coming back to me. If I set up certain alerts, like, alert me, and I really want to give the control to the provider. Like, I'm kind of tired of administrators and healthcare organizations, or even technology companies deciding when to alert a provider. I want to have a provider be able to choose, hey, if a patient tells me everything that's needed for a CHAD VAS score, alert me and tell me the score. Like, I think it would be really cool when we can kind of deliver that kind of intelligence to a provider and make it automated, or even just at their fingertips. It gets me really, really jazzed.
So to be clear, is this the final note that goes to the physician?
Oh, thanks for asking that. I do want to be clear. This note would not be seen by a physician today. This note would go to a quality documentation specialist. They would listen to the whole encounter, fix everything in the note that might be in error, and then it would be placed in the EHR for you to sign off on. So yes, this is not the final note.
Now, tell me how DAX would differ from, say, a medical scribe. And there are several options where we have to actually have a scribe in the room with you. There are now virtual medical scribes where a live person on the other end would transcribe the note. Now, how would DAX contrast with those other options?
I mean, the biggest thing is you've got technology that does the bulk of the work. And so that means several things. Like, it means that it's going to get smarter and smarter, where if you've ever worked with scribes, they're great. I trained at the University of Virginia, one of the first sites where scribes were kind of really big. I had scribes as residents. But I'd say there's different levels of quality per scribe. They come and go. They're always going to med school, and you have to retrain a scribe, and most of that training is on you. They call in sick, they go on vacation, they go on lunch break. DAX doesn't do any of that. DAX just gets smarter and smarter and smarter, and is just a push of a button, and you go ahead and document any time of day. And so, I mean, to me, that's it. It's scalability, it's technology, it's more intelligence, it's the roadmap, the vision, all that stuff just gets me like, scribes, great. And there's so much pain out there. I would never say don't get a scribe. But I'd say if you have the opportunity to try out DAX, try it out, because it's the future.
Now, one of the other effects of the pandemic is the rise of virtual care. And I was wondering if you could share your opinion in terms of the role of AI when it comes to virtual care encounters.
Yeah, I think some interesting things to me is when the pandemic first started, many people assumed like virtual care is going to be easier for the clinicians. But now you don't have an MA who's doing work for you, or a nurse who's doing work for you, some of your documentation. You're actually doing the intake of the patient. You're doing all of it just with the patient in front of you. And then you've got to document that whole conversation. And you can either be looking down at your screen or looking at the patient. And it can be even worse for a patient to have their provider typing right in front of them than having the provider kind of turning their back to them. So I really think that with telemedicine and telehealth, having a physician clearly focused on you, still using AI to help document, is the way to go.
And to be clear, with DAX, it has a pretty robust option when it comes to virtual encounters.
Yeah, really, it's able to document on any telehealth, televideo platform. You can go ahead and use DAX, and it's going to easily capture the audio and processing.
Now, where do you see the future opportunities are for automation tools like DAX going forward?
I mean, I spoke a little bit about it when I talked about, automated calculators coming back to us. I think Nuance has a lot of exciting partnerships with EHRs. We have Hey Epic, Hey Cerner, Hey Meditech. This last week, we announced integration with Athena's mobile app. So the ability to use that virtual assistant to pull up old notes, to place orders, pull up labs, all of that stuff. I think the more and more we make it so that we save clicks,
Mm-hmm.
the more powerful the technology is. So that's kind of like the short term. And then I think longer term, we'll just see more and more technology enabling the provider with the right data at the right time. Because usually it's not that providers don't have the data, it's hard to get to, and there's too much of it to actually find what's useful at times.
Mm-hmm.
And so I think it's AI needing to help us find the right data at the right time.
Now, this, of course, sounds great to primary care doctors like myself, having a AI tool passively create a note that comes back in a few hours. But when it comes to implementing these tools, it's the administrators that make those financial decisions. And certainly there's a concern about return on investment. So the next question, when do you think it's reasonable to expect healthcare organizations to see a return on investment on these type of AI investments?
So there's all sorts of different measures you can look at when you're looking at ROI. I mean, we know that just burnout on its own is, a multi-billion-dollar problem each year. We know that healthcare organizations who lose a provider, it's about $500,000 to replace them. So there's good reasons to make your physicians happy and to keep them working at your institution. Of course, increased productivity, increased throughput, faster charting so you can close those charges faster. Really, within a month or two, you should be seeing DAX pay for itself. And there's multiple different ways to look at how is it paying for itself. And one of the cool things that we love to do when we bring somebody on is pick out the measures they want to look at and start measuring them from the beginning. One thing we've seen, just talking about burnout, is we target providers who are burned out. So our pre-go live number is 72% are experiencing burnout. But within a month, that's down to 17%, which is a pretty amazing decrease. So yeah, there's lots of good ways to find that return on investment.
We're talking to Jared Pelo. He's an emergency physician and innovator. Dr. Pelo helps lead the Ambient Clinical Intelligence team at Nuance, where he is Chief Medical Information Officer. He's here to talk about the Dragon Ambient experience at Nuance. The exam of the future has arrived with clinical documentation that writes itself. Jared, I was wondering if you could share a real-life example or a case study of the difference the Dragon Ambient experience made on a physician or a practice.
It's hard for me, honestly, to pick which one to share because I have so many. I have the physician who his wife sent us a Valentine saying, "Thank you for saving my marriage." We have the physician who said, "I was going to retire in 6 months. Now I'm going to practice for 5 more years." I love those ones. We have the provider who wrote us a note and said, "Hey, I missed that the patient told me they have a history of breast cancer, but you documented it. And that triggered an MRI, which found a cancer." So there's lots of those kind of soft studies for us. But then one that's more of a hard study that I really like is a cardiologist that's working in a critical access area, able to increase his capacity by 24%. And so those patients who were waiting months and months to get in to see him were now only waiting weeks to get in to see him. He was still going home earlier than he'd ever gone home, eating lunch, all of the benefits that we kind of promised. So lots of great case studies to share.
Now, of course, I have a primary care bias as a primary care physician, but I was wondering if you could give examples of how DAX can be used across specialties. You mentioned cardiology and oncology, but give some examples across specialties and maybe some of the procedural specialties that may benefit from DAX.
Yeah, when you look at ROI on procedural specialties, it's pretty easy because the more patients you can bring in, the more you can take care of, the more you can take to the operating room if they have something that needs to be operative, the better you can compete against your competition if there's several of you in an area. And DAX currently works for every ambulatory specialty other than behavioral health. So anything, we currently do 32 different specialties. Really, practically every ambulatory specialty out there. Next year, we're going to start going into the hospital, which I think is really exciting. Procedural specialties work really well with DAX.
Now, tell me about the future of DAX. And you mentioned in terms of where you want DAX to go, but where are we with the technology itself now, and contrast that to where ideally you want it to be going forward?
Yeah, so I think my goal is that 9 months from now, we're allowing providers to see those draft notes and giving them the opportunity to choose whether they have a quality review check or whether they just go ahead and check it themselves. We also have a really great ambient device that you can put in your room, and that allows you to use those virtual assistant skills. But I see that ambient device becoming part of the care team. Like, I can imagine a day when your MA brings somebody into that room, introduces you to DAX, and DAX finishes up the medical intake or asks all the questions for the annual wellness visit that haven't been captured yet.
Mm-hmm.
And so I really think DAX becomes part of the care team. I think 5 years from now, physicians will mostly refuse to practice without some sort of ambient intelligence aiding them in their documentation and other tasks.
And my final question, Jared, what's your take-home message that you want to leave with the Kevin MD audience?
I really want people to understand that the future is now. Like, there are things out there that will solve your major pain points, that will solve your problems. Even if it's not DAX, it's worth going out into the market and finding things that make your life better, that make your patients' lives better. And those technologies are around. So put a little effort into finding what will work for you. If you want to try DAX, definitely reach out. As you can tell, I could talk about DAX all day. I'd love to talk to people, and your listeners are welcome to reach out and contact me.
And for those interested in finding more about DAX, can you share a website or contact information?
Yeah, you can really just go to the Nuance website, and we have an ambient clinical intelligence piece in there. And for anybody who wants to email me directly, they're welcome to. And my email is just my name @Nuance. So Jared Pelo @Nuance.
Jared, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thanks, Kevin.